could this new type of therapy replace the talk therapy that usually gets utilized in couple sessions? Hi, my name is Cheryl Camarillo, and I'm a licensed clinical social worker, a certified sex addiction therapist in 30 years deep, and 6 years most recently in the area of problematic sexual behavior and the betrayal trauma that results for women that are experiencing the bad side of an affair or addiction, sex addiction. So what is this new therapy? So it's called EMDR, and then there's another one called accelerated resolution therapy, and then there's another one called brain spotting. So I'm going to go ahead and pull up EMDR. These are some of the newer therapies. I call them the brain hacking therapies. So when we're talking about brain hacking, we're talking about getting to that one spot in your mind, in your brain, that is holding on to traumatic events. So I'm gonna put this down for a minute. I'm just gonna talk openly. I've worked with military people that have had trauma, and one of the things that happens when you do all the reading and all the learning about how to work with trauma, for the soldiers, they had post-traumatic stress disorder. For the women that I work with that are dealing with affairs and cheating and things like that, a lot of these women are betrayed, and it's a form of trauma, so it's betrayal trauma. And I first went out to figure out what's the best protocols for dealing with trauma in general, and I found EMDR, and it was like a life changer for me. And I felt like I hadn't offered enough information to my clients to be able to resolve some of the issues that they came into counseling for. I had 2 women that were in their 60s and had sexual abuse as a child, 4 or 5, somewhere in that age range. And they had been working with me for about a year, and it was a slow, steady pace. I was happy with how they were moving along. But after witnessing the benefits of one of these brain hacking therapies for military, I went ahead and got the training in EMDR. And when I brought the EMDR into my office and I worked with these women, it was amazing. Like I said, I worked with these women for over a year, and then I used EMDR for them to address some part of their childhood trauma. And I had one woman stand up after her first session and say, "I feel so much lighter." And I had another woman that felt so much more at peace when she thought about the past. And to be honest, I put myself out of business because they were gone within a total of 2 to 3 sessions, because they had moved past the experience. The pain that was being held in their body from their younger years was essentially like a weed. It was pulled out, and it was allowing the past to be put back in memory. So it doesn't erase the memory. It just actually removes the emotion from the event. So EMDR is one of those tools. Then I went ahead and I learned accelerated resolution therapy. It is another type of tool that is based off of EMDR, and it has a certain protocol that involves working through your story and getting to a positive end result. So it helps with closure of issues, and was amazing. And I saw that in a group format. I saw 4 soldiers go into a room to work on this issue, and they each identified their part of one significant trauma that they'd all experienced. And like that, they came out, and there was just you could see a lifting of the weight and the heaviness of the burden that they were carrying. And so I really it drew my attention. The last one, which is also involving information that came out of EMDR, is called brain spotting. And that one, again, accesses a part of the brain and helps you process through an event and reduce the intensity of the emotion, and then also allows it to be stored away. Sometimes when you're working with any of these three types of therapies, you can turn around and get this end result of lots of other things being resolved. I can remember wanting to work on anxiety, and I was in a training, so I thought I would come in and work on something from my own family, for my kids and I. And for some reason, anxiety popped up in the discussion as we were into the process. And some small insignificant event to me that happened to me in the 4th grade all of a sudden became something very intense, and I could feel the emotion, I could feel the drama and the trauma from that age range. And as I practiced and continued with the process, it just went away. It melted away, and it was the end result was that I was able to talk in large groups, because I no longer had this intense rush of anxiety from the bottom of my feet up to the top of my head. Because I would start breathing funny. I would start probably changing colors. I would turn a nice shade of red. And then, my heart would be racing. And just through doing EMDR, I was just so much better prepared to go in. And I wasn't bringing in my past fears and worries. And I was just present. I was able to sit and talk and do whatever it is that I needed to do as far as teaching. And that was the big aha moment for me. That was I'm gonna take this training all the way till the end. And just from there, I just started collecting more and more types of therapies that would help with trauma. And if you take this back to what's going on, what we're talking about here, for a lot of people that are having problematic sexual behavior, they're acting out in some way. They usually do that as one form of calming themselves down or seeking out some kind of dopamine rush. And for those that are trying to calm themselves down, we kind of look and say, was there any kind of trauma history? What kind of attachments did they witness? What kind of situation developed where it suddenly turned into something that was more than just a comfort, but more of like a compulsion, like I have to act out. So yeah, I think that's it. So could these new therapies that I'm talking about, could you find a therapist that might be able to help you? Definitely. It's possible. You want to make sure that you find somebody that's trained in the area. You don't want somebody that's read a book and said, I can do it now. There's nothing like quality training, going to the people that actually wrote the books on this stuff and can actively teach and make sure that you acquire skills. So of the three, I'm going to say that brain spotting ultimately is my favorite therapy. I use it in couples counseling because if I am working with one person and they get overly emotional, I help them work through that issue using brain spotting, which involves a little wand and a visual, or sometimes it's just figuring out where's the spot where the memory seems to be, in the brain. And so I really enjoy working on that, and it offers the partner who's sitting in the other seat watching an opportunity to hear how things are being perceived or how they were being processed, and what was meant by the behavior. And then I go back to the partner that's observing and say, could you correct any of this? Is this actually what's going on? Because we walk through life with a lot of assumptions. We see a situation and we just come up with all kinds of thoughts about how the situation should be managed. So if you've just found out about your partner cheating and there's discovery, you might be walking around saying, he doesn't love me because I talk too much. Well, then the result is you turn around and you might tell yourself, don't talk so much. That's really not the issue. The issue is maybe with the person that's acting out. Maybe it's their past, maybe it's their needs and issues that they're trying to work through, and it has nothing to do with you. It does have something to do with you in terms of the pain and the, you know, the sense of abuse that you've been struggling with. So again, my name is Cheryl Camarillo. My website is CherylCamarillo.com. You can see it down in the description below. I have a free webinar for people that have been in betrayal trauma situations, and you can sign up, and I'll send you, you know, emails that have the 3 different webinars on there. It's going to talk about what's the definition of betrayal trauma, you know, what are the treatment routes for betrayal trauma and for sex addiction, and then how do you start the healing process for yourself. So all that information down below, and look forward to talking with you. I'm going to do another, you know, I'm going to do another video, and the next one is most likely going to talk about, you know, the pain process and how do you decrease that when your partner has done these things. So thank you.